stop. Before you take another vitamin D tablet, sachet or drink, you need to see this. Nearly 90% of Indians are vitamin D deficient, despite living in one of the sunniest countries on earth. And the worst part, most people are making the 5 critical mistakes that are keeping them deficient. I'll show you just one simple 30-second self-test that you can do right now, and it might point towards vitamin D deficiency. When I press my thumb on the shin bone, and if you feel that you have pain or tenderness, it could be vitamin D deficiency. But apart from this, even if you have foot pain or weak muscles, keep watching this video. I am Dr. Sumit Kapadia, and in the next 8 minutes, I will show you exactly which mistakes are sabotaging your vitamin D levels and how to fix them today. Mistake number 1, you're getting sun at the wrong time. If you walk before 10 a.m. or after 2 p.m., you are wasting your time for vitamin D. And here's why. The maximum ultraviolet B rays come from the sun between 10 a.m. to 2 p.m. and that helps build natural vitamin D from your skin. And what can you do? Set a phone reminder for 11:30. Step outside for just 5 minutes with your arms and probably your legs also exposed a little. Try not to apply sunscreen. Do this 3 times in a week, and that's enough for your body to manufacture vitamin D naturally. Yes, it might appear hot, but that's the only window that works the best. And if you're taking medicines for vitamin D, this second mistake can make it dangerous. I had a patient who took 60,000 units weekly for 6 months because her friend recommended it. She ended up in an emergency with kidney stones. So before you take vitamin D, get the blood test done. Check your vitamin D3 levels. It costs maybe around 500 to 800 rupees, and your number should be between 30 to 100. If it's below 20, you're deficient, and above 100, then you are at risk of toxicity. And here's what nobody tells you. Always ask for the D3 levels, not the D2 levels. D3 is cholecalciferol. Your body absorbs it 3 times better than D2. But even you get this right, the mistake number 3 can make it completely ineffective. And mistake number 3 really shocked me when I first learned it in medical school. You can take the perfect dose at the perfect time and your body may not still absorb it. Why? Because you are taking it on an empty stomach. Vitamin D is fat-soluble vitamin. Without fat, it passes right through you. So what can you do to fix it? Take vitamin D tablet after your breakfast or lunch, some meal with say ghee or any other meal that has fat content on it. This one change can double your absorption. Make sure you do it right. And one more thing, don't take calcium and vitamin D at the same time. Space them 4 to 6 hours apart for maximum benefit. Now here is mistake number 4. Even with the perfect sun exposure or perfect dose and time of supplements, these 3 things can keep you deficient. Excess weight. Yes, if your BMI is above 30, vitamin D gets trapped in the fat tissues. Second can be certain medications. Steroids, diabetes medicines, and sometimes thyroid medications also may interfere with absorption of vitamin D. And the third important thing is air pollution. Delhi's AQI, which is above 300, would probably block more than 40% of the ultraviolet B rays from reaching your skin. Do check with your doctor if any of these 3 apply to you. You may then need a higher dose. And this mistake number 5 is probably the most common one, and that is not taking care of maintenance dose. You stop it when you feel better. And this is like charging your phone once and expecting it to work the whole week. Would it happen? No. So after your initial treatment, you do need a maintenance dose. Most people need around 1000 to 2000 units daily or 60,000 units monthly as a maintenance dose. And you may retest yourself 6 months later to stay in the range. I have seen patients who have dropped from 50 to 15 in just 4 months after stopping supplements. Don't let that be you. So here's what you can do today. First, book that vitamin D3 level test. Don't just guess your levels. Second, set that 11:30 a.m. reminder for sun exposure. Third, make sure you have your supplement with your breakfast. And here's my challenge. Comment below with your last vitamin D level. I want to see how many of you are in the deficient range. If you don't know your level, you can comment doing this or testing it this week. If you found this video helpful, do watch this next video where I show you the mistakes that people make while taking another popular vitamin, and that is vitamin B12. This is Dr. Sumit Kapadia reminding you that small changes create big results.